So I'm going to do a whirlwind tour of treatments, literature review, very full schedule, and I'll try and keep it at a reasonable pace and get through it. No disclosures. What I'm presenting is what I've gathered from the literature, what my clinical experience is. I'm not specifically advocating for a particular treatment, just discussing what is known at this point on these treatments. So for mold illness treatment, it is individualized. General principles do apply. We discussed this previously. You don't necessarily have to have labs. They all serve a purpose, and it's good to get a baseline at CBC and Chem panel. Avoidance is a very key treatment, especially initially. The initial items from the initial exposure can remain very problematic for people, and it is important to avoid those. They will tell you if they accidentally get re-exposed as well. But in time, they should be able to tolerate most non-water damage settings, and I'll discuss that course that we commonly see in patients. So general environmental controls that we're all familiar with, just reduce total load, avoid pesticides, combustion products, VOCs, vinyl chloride, heavy metals, problematic locations, and excess EMF exposures. If outside air quality is good, get fresh air. Cooking, you don't want anything leaching into your food, so glass or ceramic is optimal. Triple element air filters with HEPA, carbon, and zeolite are very helpful, symptomatically and also in terms of particulate measurements. I've had people measure before and after with these air filters. I would avoid any with ozone and even the UV lights in the filters, because that can create some ozone and can be a respiratory irritant for some people. I would use water filters, ideally where the water comes into the home as a whole house filter, and then additional drinking water filter. If you can't do that, use a shower filter and a drinking water filter. Bedroom sanctuary does remain very important for our patients. Optimally, a non-carpeted, non-contaminated bedroom. Bedding, that is definitely something you don't want to bring from your moldy house. It's surprising that you actually have to remind people of that, but really, really don't bring bedding from a house that got you sick. And minimize dust-catching items and knickknacks in this setting. And a healthy mattress is optimal as well. So glutathione, I found, is really the powerhouse treatment for the majority of my patients. So I'm going to spend a little time talking about it and reviewing some of the many effects that have been seen in the literature for glutathione. So glutathione is a tripeptide, glycine, glutamine, cysteine. We all make it. Precursors, whey protein, and acetylcysteine, powerful antioxidant. Deficiency causes cellular damage and mitochondrial degenerations. And it's important to note that the whole blood glutathione doesn't necessarily differentiate between reduced and oxidized glutathione. So you cannot simply rely on a total glutathione level to decide not to treat. Now, if the total is low, there's a good chance that the reduced is also low, but you can't use it to rule that out. So these are some of the many things that glutathione has been found to do. Neutralize singlet oxygen, cofactor for other antioxidants, regeneration of vitamin C and E, free radical neutralization. It's a part of phase 2 detox, useful for mercury detox, regulate cell proliferation and apoptosis, and very key to mitochondrial function. These are some recent articles. Random effect, not that relevant to what we do, but apparently skin lightening effects. This one I thought was really interesting. This is non-alcoholic fatty liver disease. This was a 2017 publication, 34 patients, and they were given glutathione 300 milligrams a day for 4 months. And ALT levels significantly decreased following treatment with the glutathione. And triglycerides, non-esterified fatty acids, and ferritin levels also decreased with the glutathione treatment. So I know there's a lot more non-alcoholic fatty liver disease that's being seen. So this is, another application for glutathione. This is a repeat of that one. These are some conditions that have found to be associated with decreased glutathione. So a lot of the neurologic things, similar to what we see, Parkinson's, Alzheimer's, ALS, respiratory conditions, asthma, COPD, autoimmune disease, cardiovascular diseases, some of the age-related eye diseases, liver disease, cystic fibrosis, and aging in general. This was something I had not directly experienced in my patient population, or certainly hadn't used for this, but it was interesting to see that it actually had a beneficial effect on the growth of Pseudomonas. So there are antibacterial effects to glutathione as well. Again, the patients that I see, back to clarify something that patients sometimes say, that, I'm sick because I don't make glutathione. That is not true. You do. You might have differences in the enzymes and how you handle it. But what I think mainly happens with these exposures is that you use it all up because you need it, and you need it day after day after day. So even if your production was more than sufficient for a normal toxic load, it does become depleted. People do have some genetic mutations that do affect how glutathione is handled, the enzymes that handle it. However, it's still unclear exactly what effect that has on health. So this is something we will continue to explore. You do need to use sequestering agents if you're using glutathione, because glutathione does allow your body, your liver, to now process toxins and will dump them into the gut, which is what it does. But the gut is always trying to reabsorb nutrients, so it will reabsorb these toxins. So you want what Dr. Gray called a catcher's mitt, a binder, a sponge. The one that I use the most is activated charcoal. So I'll talk about all of these, but that's the one that I found to be able to use as a single agent, as a sequestering agent. So do be aware, of course, that initial treatment can trigger detox symptoms. I like to tell people that what you can experience as a detox symptom would be anything you could experience with a hangover. And if someone's never experienced a hangover, you can explain that. But headache, achy, tired, maybe a little nauseated, and it will typically last one day. What you do if that happens is you don't take glutathione the next day. You might take more of the activated charcoal or whatever other binder you're using. You get plenty of fluids, get good clean air, and understand what's happening. And that is also much more common when you initiate treatment or if you've taken a break from treatment. We'll talk about the safety in a minute. Glutathione is exceedingly safe. I haven't actually seen getting into trouble with glutathione in the literature at all at extremely high doses. But when people feel miserable like this, it can be upsetting to them. But if you know what to expect, it's better. I also do like to remind people when they're doing these treatments, unrelated things can still happen. So if it is a symptom that you would not expect to have with a hangover, like losing vision in your left eye or not being able to move your arm or getting a cough and fever, get that worked up. See somebody, because the patients get confused because they're experiencing all these new and confusing bodily sensations, and sometimes they tend to lump anything that's happening under the umbrella of the mold exposure or the treatment for it. So it's just important to remind them. I found oral liposomal glutathione to be the most convenient, cost-effective, definitely first-line treatment. It is best absorbed on an empty stomach. Waiting about 20 minutes after seems to be enough, and once a day is okay. If you're getting to higher doses, you may split up the doses. Transdermal gives less systemic delivery. It's good for some kids who aren't that compliant or certain adults who are very sensitive and prefer it. IV, you get high systemic levels for a brief period of time, and then it drops back down. I haven't found it to be necessary in my treatment. If people are choosing to use it, that's fine. And again, these are the types of systemic glutathione. I'll go over some other delivery forms in a minute. So this was a study looking at low glutathione status in ear, nose, and throat conditions that have been found to be associated with oxidative stress. And kind of conclusion is, there may be benefit to glutathione in these conditions. This is a study of oral liposomal glutathione and showing benefits on natural killer cell function, their cytotoxicity up to 400%, and lymphocyte proliferation elevated up to about 60%. So conclusion that improving the glutathione stores can have a positive impact on some markers of immune function and oxidative stress. Study in HIV patients, also a condition found to be associated with low glutathione, found that they also had beneficial changes, including improvement in TGF-beta1, which was what Dr. Guilford had discussed yesterday, and other immune markers stabilized with supplementation with the oral liposomal glutathione. Improved macrophage function, and also it resulted in a decrease in the intracellular growth of Mycobacterium tuberculosis. So another antimicrobial property of glutathione. So in a study looking at neuroprotection of glutathione, one of the big takeaways to me was the safety. No toxicity observed in 200-fold the effective concentration of glutathione. So really couldn't get those rats in trouble with too much glutathione, and it's always nice to have a treatment that's in that category, that is in the exceedingly safe category. This was look at it with autism spectrum disorders, and found some increased levels of glutathione stores, specifically with the oral liposomal glutathione. This is the same study. Increased glutathione levels, but not the whole blood. So what I just said, very safe. I have not heard any reports of any significant risk, hospitalization, death, or long-term effects from the use of glutathione. I've heard a lot of drama from patients who've had bad reactions. That is absolutely 100% true. But you can reassure them of what we know about this, that it is safe. And I'll just address the issue. There are certain patients who will state, for whatever reason, because somebody told them something unrelated, like they have a sulfa antibiotic allergy and then they're told they can't take glutathione, which turns out to be just the opposite, actually. That's associated with low glutathione stores, the sulfa antibiotic reactions. Or they're allergic to sulfur, which is not possible because we have sulfur, things like that. So sometimes it takes a little, but what it really is the reactions can be tough. That is very true. So, you go very slow with sensitive patients and sort of talk them through. And this is what I'd said earlier, kind of the hangover-y type reactions are what you're going to see. Nebulized glutathione has shown beneficial effects in cystic fibrosis, emphysema, idiopathic pulmonary fibrosis, otitis media, rhinitis, emphysema, HIV. It does raise glutathione levels in the epithelial lining fluid, decreased pro-inflammatory cytokines, and increased CD4 and CD8 in bronchoalveolar lavage fluid, and improved FEV1 and decreased Pseudomonas growth in cystic fibrosis. In my patients, I found that it's a nice systemic delivery. Some people really just prefer it. It is good for the lungs, and it seems to have a benefit on anxiety. And I've thought about this a little bit. I don't know if it's just the calm, deliberate breathing or the antioxidant effect, the anti-inflammatory effects of the glutathione, but it clearly does. I had one guy who would speak at his garden club once a year, and he didn't use it ever except that. He'd come in for performance anxiety, and it held for him for a few hours. He had, extreme anxiety with speaking. So, again, no published reports of severe asthmatic reactions, hospitalization, status asthmaticus, or death from nebulized glutathione. There was one study of 8 whole people in 1997, and it's important noting that it did increase bronchoconstriction in some of these patients. Not entirely sure what was in the solution or the very specifics of this. This is, but because of this, I tend to give the first dose in my office or have them take it in another physician's office, not because they've ever required emergency resuscitation, just because I want to check that. And some people will get a little bit of wheezing very briefly, because I think it's a bit of a mucolytic. So there's a little bit shaken up, they get that, they feel fine, it clears out. And then oftentimes another thing I've noticed is they just take deeper breaths after. I don't know if that goes with the anxiety reduction or you just have increased airflow, because I'll listen to them before treatment and after. So again, one study showing some wheezing, but nothing serious has ever been shown or reported that I know of with nebulized glutathione. And yeah, no subsequent studies. Intranasal glutathione, found that to be very effective for neurocognitive symptoms. It also has benefit of being an antioxidant and having beneficial effects on the nasal mucosa. You get brain delivery through the cribriform plate of the ethmoid sinuses, which is where the dendritic processes are directly exposed to the environment. The instructions that I typically give people is 2 quick snorts per side, sniff up just enough to keep it from dripping out, but not a big snort, and then prepare to lay with your head back for 5 or 10 minutes. Experiment with the position, because sometimes people feel it very quickly if it's going to work. They get a noticeable kind of head clearing. Typical dose that's used would be in this concentration, 100 milligram per ml. And it doesn't tend to be an irritant. It's pretty well tolerated. Can bypass the blood-brain barrier. Studies of other similar size, low molecular weight proteins have shown that it can pass the blood-brain barrier and get through as quick as a minute, which seems about right from what people experience. They do often feel something in that 5 to 10 minutes, benefits in rhinorrhea. And then there was a study where it was being looked at for a number of treatments. It didn't address the outcome for these particular conditions, the chemical sensitivity, allergy, Parkinson's, Lyme, or fatigue, but it did address tolerance, and it was very well tolerated. If there were going to be side effects at all, it was irritation, bloody nose, headache. Sequestering agents, we talked a lot about that. I can whiz through this. High surface area to volume, bind toxins to reduce enterohepatic recirculation. They can be taken together, so if you are using more than one, you can take them at the same time, and that helps because of the timing issue, because you do want to avoid, you just take them apart from other medications and supplements by at least 90 minutes in either directions so that you don't negatively affect the absorption of those medications or supplements. And of course, they're not absorbed systemically. Activated charcoal is my go-to, easy to take in capsules, although some people like the powder, inexpensive, was by far the most effective for trichothecene mycotoxins in an Army study of 1985, very extensive study. They had some good budget for studying trichothecenes because I guess as biologic warfare agents, and charcoal was the best. Typical dose, somewhere around there, 1,000 to 1,500 milligrams twice a day. Again, it's been found to be effective when it's the only sequestering agent, and in most cases in my practice now it is. So these are some of the studies on effects of these various sequestering agents, and some we've known all along, some are newer studies. So this was that the activated charcoal, along with bentonite, can also be helpful for aflatoxin. So we typically think aflatoxin, clay, Trike's charcoal, and ochratoxin, cholestyramine, but there's overlap. We can get benefit, for example, with ochratoxin from activated charcoal as well. This was a study of bamboo charcoal compared to a clay in aflatoxin, B1, and the bamboo charcoal could be as effective as the clay in removing aflatoxin. Another study, bentonite, clay, activated charcoal, and this newly discovered yeast, Trichosporon mycotoxin. And this is a February 2018 study, so I guess it's really newly discovered. They were looking at effects on mycotoxins, aflatoxin and ochratoxin. And in conclusion, it was for aflatoxin, bentonite, most effective activated charcoal second, and this newly discovered yeast, the Trichosporin mycotoxinovorans yeast. And against ochratoxin, it was this yeast, clay, and activated charcoal in terms of order of effectiveness. Cholestyramine, a bile acid resin, again, most effective for ochratoxin, but it's a long history of use for numerous toxins and also binds endotoxins, as we learned a lot about yesterday. GI complaints are fairly common for patients who acquire it through the commercial pharmacy powder, which has either sugar or artificial sweetener or aspartame and artificial colors and other additives. And so if someone's going to have GI distress with it, it'll be if they take it that way. Usually they tolerate it pretty well in the pure powder, except it is god-awful to swallow unless you mix it with something acidic. It just has this weird, slimy yuckiness. So anything acidic is fine, orange juice, lemonade, lemon, just anything. I even had a patient take it with coffee. She was raving about how much better it was tolerated. But if you're doing the pure powder, you definitely would want to mix it with a little something. This is a typical dose that would be used, but it doesn't have to be exactly this dose, 4 grams every 12 hours. I will say that using it with charcoal decreases the side effects of the bloating, the GI side effects. So if you're going to do them, you take them at exactly the same time, it's helpful. This was the study I referred to yesterday where cholestyramine did exactly what we wanted it to. It took ochratoxin out of the blood and the urine and moved it into the gut, into the feces, where it would be excreted. So that was an animal study, of course, rats, but it showed it did what it needed to do. Clay, most effective for aflatoxin. You want to make sure it's sourced well because there can be some heavy metal contamination, usually well tolerated. Sometimes a little dry mouth dehydration can occur, and just dose per product instructions. But there is a pretty good product that's a capsule that can be used twice a day as well. Bentonite, again, helpful for aflatoxin and ochratoxin. And the immune damage from ochratoxin and aflatoxin. Chlorella has been found to have some beneficial effects with mycotoxins, helpful with mercury exposure. Does have some iron, so I would avoid in iron overload conditions and hemochromatosis. Occasionally triggers symptoms in people with autoimmune conditions. I only put this because I've heard it, although I've never actually experienced it. It might just be urban legend. I'm not sure if you guys have experienced it. We can talk about it after, but I included it. And you do need a non-contaminated product because those have grown in the ocean have already done their awesome job of absorbing a bunch of garbage from the ocean. So if you then take it, you've gotten that. So there are some products that are grown on filtered water, and I can share the name of that with you. Dr. Jennis, who studies this product, had one in particular that he found was very clean of contaminants. So that's the one I've been using. But I think any that are grown on filtered water would be all right. This was a study on some essential oils against damage from ochratoxin, oregano, mint, basil, and sage. And also some probiotics, bifidobacteria, streptococcus, thermophilus, and yogurt, just yogurt cultures. And then ozone, which was probably delivered to the food source with the ochratoxin, slightly decreased it. It wasn't spectacular. Nutritional effects of sequestering agents, we don't really know. Recommend following nutritional panels, impact reduced if they're taken apart from food and supplements. Monitor levels of fat-soluble and other vitamins. Only study I could find was with clay that showed that it was helpful in reducing the bioavailability of aflatoxin and did not interfere with vitamins and other micronutrients, at least the ones they looked at, which was vitamin A, E, iron, and zinc. Nasal antimicrobials. Idea behind this that I addressed yesterday is not so much that I'm worried about any invasive infection, although there's been rare reports of that, more that the colonization could be just stimulating an immune reaction in a patient. And then Dr. Brewer it's speculated that it's possible that if there is colonization that they could be secreting mycotoxins. Don't know if there's any proof of that, but that was an idea he presented in a paper. If you get, for me, nasofungal cultures, just because of my hospital lab, are helpful, but they're not the whole story. We went over that a lot yesterday. Limitations in collections and growth of them. But if you actually grow something, you're almost never going to get a sensitivity on it. So you're going to have to just go clinically and use an topical antimicrobial that seems to be effective for the patient. My go-to first line is a 1% itraconazole. It's the greatest part is that everybody handles it. You just don't get, it's not irritating. And so, the worst that happens is nothing. They don't get better. If they get better, you talk to them and see them in a month and see how they're doing. If they're starting to show improvement, I'd say they probably should stay on it 6 to 8 months to get the benefit. Amphotericin B is a lot less well tolerated. But again, I'm talking only topical. I at the moment don't have any patients on oral antifungals. I almost never do. So I have a different approach to that. I find the topical to be safe, effective, 1% solution. I talked to a pharmacist once. He said at most 1/200th of that was going to get absorbed at most. So with the topical, it's just, it's like putting cream right on your rash, and that's helpful. Topical Ampho B does help some people. It does have some biofilm disrupting effects, and it might be the one that someone's sensitive. Much more brutal, though. Much harder to tolerate. Nobody likes it. I do recommend rinsing your nose, neti powder squirt model, 2 to 4 times a day. If we get 2, we're happy, but I've had some people anecdotally report benefit from doing it more often. Idea being your nose is a filter. The cleaner you keep it, the less you're exposed to. There's these biofilm disruptors. Antimicrobials can be added. I would probably limit it at this point based on, some other people's studies on finding some bacterial resistance when they frequently use nasal antibacterials. But you can add them into some of these atomizers and stuff if they have an acute infection. They might have some bacterial overgrowth, and it's probably a more direct way, again, to get the antibiotic where it needs to be versus the whole body. Minimal side effects. There was a study on fluconazole nasal spray for allergic fungal sinusitis, small study, 16 patients. And they did see stabilization in disease without significant side effects in the patients that did receive that. Skin treatment, use charcoal soap with bathing. You're going to be encouraging them to sweat a bit more. They might get more skin irritation. You get that everywhere now. They have it, CVS, everywhere you get charcoal soap. You get charcoal lemonade at coffee stores. I don't know. I think there's some people are like somehow getting onto charcoal. But easy to find. Acne soaps, charcoal soaps are everywhere now. Do bathe soon after sauna and sweating. If they have a rash, consider using ketoconazole as a body wash where you lather or loofah it up, step out of the shower, you put it on, stay out of the stream about 90 seconds, and then rinse it off. Kind of nonspecific rashes. There's no particular pattern, usually just little papular rashes. And for some people, it is obvious that helps them. And then they stay on it, and then if they go off it, either it's all cool or they go back on it if they need to. So. Diet, I do recommend a trial of a gluten-free diet because of the inflammatory effects on so many people. There will be a handful where it's just not a thing, in spite of what Dr. Carnahan presented about the temporary effects. Some people, it may really not be their big issue, but it's certainly worth a try when you're in a really inflamed state. I tell people that there is no purpose in eating a reduced gluten diet other than to practice for going gluten-free, meaning you're not going to notice anything clinically if I tried eating less gluten. That's not going to tell me whether gluten's an issue for you or not. So just, it gets confused a lot. Dairy-free diet, for some people, especially it seems to be people with respiratory nasal type symptoms, same deal. You try it and see if it's helpful. Avoid any specific food allergens. I just want to talk about this for a second. Dr. Marinkovich had a very elaborate diet that involved avoiding any type of moldy food or leftovers or anything that could possibly have mold. However, that would keep you away from fermented foods. And fermented foods are an excellent source of probiotics that really are alive because they've done something to a food. If you buy a pill on a shelf, and they look at it, sometimes 40% or so are dead, so you have no idea if they're alive or not, so I like fermented foods. Plus, it's also a very normal way our body's used to getting things as food. So, in general, for the vast majority of patients, they benefit immensely from fermented foods. And although I have great respect for Dr. Mirinkovich, and I'm sure there are patients who benefit from that particular diet, it's not one that I typically endorse. I'd rather they have the fermented foods. Garlic, coconut can be helpful, especially if there's any gut yeast or other issues, and cruciferous vegetables, increasing them to some degree for nutritional reasons. Unless there's a specific reason, that's about as much as I burden my patient with diet-wise. People, if that's what they choose to do, to go very complex and various diets, it might be great for them. But these are my high points that I think are the highest yield. So this is a general article on air pollution and multivitamin supplementation, showing, pretty much multivitamin, showing benefits from multivitamins and antioxidant supplements. Magnesium is a big player, cofactor in more than 300 enzymatic reactions in the body, energy metabolism reactions. I think it's the same as glutathione. I think your diet might be fine, your absorption might be fine or not, depending on how sick your gut's gotten. But I think you just use it up when you're dealing with these chronic toxic exposures. So it needs to be replaced, and the lab tests are not perfect indicators. It's very safe orally, especially if it's not combined with something silly like aluminum. We don't really see trouble taking, where you get in trouble with magnesium is you give it IV. If you give it orally, you take too much, typically you have diarrhea. There's been a report or so of problems, but again, it was combined with aluminum. So, but you do need to do it for a long time, and it's not a wow moment. You don't take your magnesium and, wow, I feel great. You do it usually at night, and, depending on if you're prone to diarrhea or constipation, you pick different forms. If you're prone to constipation, you add a little oxide in, and including some other forms, the chelates. If you get loose stools and diarrhea, then you try some of the other forms, glycinate, or you go slow, you switch brands. Sometimes you have to go to Transdermal because their guts just don't handle it. But it is an important thing. Some of the things that have been reported in the literature to be affected by it are some of the things we see. So the anxiety, respiratory symptoms, pain. Omega-3s. The dosage of magnesium, typically about 300 milligrams twice a day, and you can work it up to gut tolerance a bit. Omega-3s, lots of benefits. This is the typical dose. Some of these things are off the Mayo Clinic website, some that have been studied, coronary artery disease, arthritis, have a little higher level of evidence. And then this whole bunch of things, which are stuff we see, cognitive, fatigue, anxiety, depression, inflammation. In general, most patients benefit from a good dose of omega, about 2 to 3 grams typically. Some people will bruise at lower doses. You got to watch that if they're having surgeries and stuff. Be careful. GI symptoms, I think that really mainly has to do with rancidity issues, and you can search for products that have tested better on that and avoid if you're allergic. Vitamin D, got to get that optimal. It's common in general. It's common in mold patients. Again, associated with, again, from the Mayo Clinic website, cognitive issues, respiratory problems, even muscle weakness, and asthma and autoimmune diseases. Complicated discussion on whether it's the low vitamin D that causes this or the conditions that cause the low vitamin D. That's, going back and forth quite a bit. I still think people benefit from getting to an optimal range of vitamin D, and you can dose it depending on what their level is, 5,000 a day. Sometimes you need to go higher, but I just made a note that some people do better on the 50,000 once or twice a week, and D3 is best. Zinc, often beneficial, easy to test on panels. You do want to follow zinc copper and make sure those ratios stay okay. This is a start point that can be used, but you have to tailor it to your patient. These are some of the conditions that have been looked at and studied with zinc, and again, some overlap in the things we see: cognitive issues, ADHD type symptoms, immune. So commonly needed. B vitamins, cofactors in many enzymatic pathways. Be a little careful. Some are mold-derived and bother patients. Methyl B12, folinic acid, or MTHF can be helpful with people with methylation SNPs, like the MTHFR SNPs, and that pretty much takes care of it, so it doesn't have to be a drama anymore, these SNPs. I have found methyl B12 subcutaneous shots to be very helpful. And just in general, everybody who works with any form of B12 ever at any conference, I was at a huge primary care conference, the shots just work way better. Even if sublingual and all these other things. So, so if someone's willing to do it, they just work better. This was a study of high-dose vitamin B complex, vitamin C, and minerals on men, 250 men, 30 to 55 years old, who were given some challenging cognitive type tasks, and they found that the supplementation led to improved ratings of stress, mental health, vigor, and improved cognitive performance during intense mental processing. CoQ10, typical dose around 100 to 300 milligrams a day, shown to be helpful with ochratoxin poisoning, with or without melatonin, helpful for mitochondrial dysfunction. Study where it was combined with NADH and CoQ10 found decreased fatigue after 8 weeks of treatment compared to placebo. Mitochondrial dysfunction and fatigue. There's a lot on this. I just picked a few. CoQ10 was found to be significantly lower in ME/CFS patients and depressed patients with chronic fatigue compared to controls. This is something that can be measured, by the way, so you can measure CoQ10 levels. Oxidative stress, significant mechanism of injury. So again, other antioxidants, A, C, and E, improved glutathione parameters, vitamin C, helpful for several different parameters. Typical dose of vitamin C, about 2 to 4 grams twice a day, but that can vary. But I would encourage the twice a day. Buffered is tolerated better if it's a higher dose. This was a ochratoxin A study, and antioxidants were found to be helpful for chronic exposure to ochratoxin A. Probiotics, got a lot of detox in our gut. I talked about this study yesterday when they gave rats neomycin. They had a real hard time dealing with ochratoxin, which is why you got to be really careful and judicious in your use of antibiotics for many reasons, but this is just another reason. We know the immune stuff with the gut, but the detox we don't always think about. Probiotics helped decrease bioavailability of ochratoxin A and aflatoxin. There's many different probiotics that have specifically been studied. Some of these specific strains are here, beneficial effects on glutathione markers, and decreasing the effect of the mycotoxins. These were, again, some other types of probiotics that were used. Saccharomyces boulardii, in particular, improved biochemical profiles in ochratoxin poisoned chickens. So S. boulardii has a lot of benefits, but that was specific to ochratoxin. This is another probiotic study, aflatoxin. Melatonin increased antioxidant markers in ochratoxin A exposed rats when it was given with or without licorice. Not sure how they picked licorice. I'm sure they read it at the time. They elaborated on it, but that was what they chose to use. With CoQ10, it was helpful for ochratoxin, and also was helpful for aflatoxin. Again, melatonin is another one of these that is very safe, that one of our speakers presented in the past was discussing how they found a lethal dose 50 for melatonin. So, again, people have optimal dosages and things like that, but it's nice when you have safe things. Some foods looked at, the broccoli sprouts, the sulforaphanes, lycopene, other vegetables, resveratrol have all been looked at and found some benefit with mycotoxins. Lifestyle choices, avoid exposure, organic diet to minimize exposure to pesticides and other contaminants. Do start moving some. I get that many of our patients are very debilitated. We don't want to induce post-exertional malaise. Most people can walk a little bit, You figure it out and gradually increase it, and benefits all around. But I kind of remind them that our venous and lymphatic systems don't have a pump. They rely on musculoskeletal movement. So when you are fully sedentary, you are working against yourself. And, that's a whole other conversation of all the literature benefits of exercise. I am not talking about somebody who's bedridden climbing a mountain at all. It has to be very gradual and monitored. But a lot of people aren't in that severe of a state, and they can walk a little. And if they start to walk a little, they can walk a little more. So sauna, I'm going to go through 2017 up to 2018 was a banner year for sauna literature publication, all from Finland. So found some cool things out about sauna. We all kind of know sauna, but we don't always, remember it and emphasize it. Epsom salt baths can be good too. You just want salts that are sourced well and not contaminated. Some of them from China, people have had problems with. So, sauna, quickly. Inversely associated with dementia and Alzheimer's patients. I believe this was quite a large study. Yeah, 2,315 Finnish men. And this one actually made it to the mainstream media. I remember seeing this one. So that was cool, not that surprising to us. Improved health, quality of life among octogenarians in Finland, and 524 of them. Improved arterial compliance and diastolic blood pressure as well, and it was a little bit smaller, 102. And reduced the risk of respiratory diseases. And in this case, this was almost 2,000, 1,935. And that was, they defined it as asthma, COPD, and pneumonia. So all of these studies in the last year. Sauna safety. Never use it when you're impaired by anything. Medication, alcohol. You need to, be aware of what's going on. So just don't go in it if you're impaired at all, or sick, or pregnant. And, if people are going to put in the kids, which I don't specifically do, but I know in the autism community, some people have had, the door needs to be right open, and, that's not something I would give instructions on doing, but that would be an extra precaution if people choose to do that. Short, minute-long interviews. You can go up to 30 minutes. Some people can go longer. They've used some of the 9/11 firemen, and they put them in, and it's out of a sauna all days for days on end. So it's not that there's like this cutoff and something weird happens at 30 minutes. This is just a typical guideline. Stay hydrated, get minerals, get salt, if you're really using it. Risks, overheating, post-sauna, hypotension, and syncope. That is real. You don't want to move quick. You vasodilate the sauna, and if you're laying down and go up, you can have problems. And then, of course, injuries from the falls. If you do pass out from getting up too fast, and dehydration, mineral electrolyte depletion. And I guess you could burn yourself. These are two therapies that I have not ever specifically recommended, but I wanted to see what was in the literature because my patients have done them and reported back positively. So I looked at the literature. I'm going to go pretty quick because I've got to jam through here, but the most common one is autotransfusion. Take it out, put it back in. They address some of the other things like the nasoinsufflation Dr. Nathan mentioned, which did appear to be prudent routes of administration in this article, 2017. Do not use it in the lungs or eyes because it can cause tissue damage and can have transient benefit in oxidative stress, improve circulation, affect bacterial fungal cell wall lipoproteins, and have beneficial effects on TGF-beta1. So it's always interesting when you find something that you see in multiple different treatments and that we've seen in our patients in their labs. Coffee enemas, that's another one. Again, I haven't specifically recommended, but the patients who it works for, they rave about it. Very quickly, very little published literature, obvious risks of burning and trauma and things like that. There were very remote articles published, and I could not get the actual articles where they talked about some bad things from it, but it hasn't been since 1984. So I'm not really sure if people are dying of coffee enemas, because I really can't, review the initial. It was used as a bowel prep agent for small bowel endoscopy. It was found to be effective for that and additionally safe. They didn't have any complications from it. They think it's from biliary dilation that is causing some effects of that nature, and they looked at some antioxidant markers in this study and didn't really find anything in this study. And then this is just something we've all probably wondered, how much caffeine do you get from it compared to taking it orally, and get about 3.5 times less than if you took it orally. So it's not necessarily just a caffeine thing that people are liking. Talk about trisalts. This is what they contain. Very cheap. Bottle, about $10. And I have 20 or 30 doses out of that. So patients, some of them really like it. Works very fast when it works. It also works really good as an antacid very fast too, but obviously the bicarbonate. But it will kind of reverse sometimes food reactions, sometimes neurocognitive symptoms, and typically a teaspoon in water. Don't use it if you have a problem with salt, or you can get the sodium-free ones. And some people sip it all day, and they find it just ramps down some of their cognitive symptoms. And just anecdotally, I've had 2 patients decide to stop paying $500 a month for nasal VIP because they got more benefit from trisalts at $10 a bottle. So, because they were using it specifically for those kind of neurocognitive spaciness type symptoms. Hyperbaric oxygen, I haven't seen it to be too great in my practice, haven't specifically recommended. There was a small published study where there was some improvement in attention span in mold patients, and it was 10 sessions at about 1.3 atmosphere, so not too high a pressure. My only thing, if people want to recommend it and are comfortable with hyperbaric, just don't do the super high pressures. I did have a patient who came to me and had been doing it, and she blew out a retina. It was not good. It was, over 2 atmospheres, 2.2. And, so people know way more about this than I do. But I'm just, I think for what we're doing, look low if you're going to do it. Treatment challenges, talked about a little bit about this yesterday. The extremely reactive patients, especially the ones who believe I'm fine unless I'm exposed, because then there's nothing to do for you. You just have to keep running till you find the perfect place, which no one has ever done. Seriously, 0. No one has ever done that if they keep running to the perfect place. So that is really a challenging thing. They go from place to place. But what is common is when you first do start treating, you get what we call the unmasking phenomenon, where all at once you're noticing being sensitive to way more things. That is really typical, normal, and if you counsel people ahead of time, that's going to happen. Might last, 6 months to a year. It's okay, make you more aware of things, not going to hurt you. Then that's really typical, and that's not the difficult patient I'm talking about. That's a pretty typical patient. About 5 to 10%, start becoming more and more reactive. Occasional breakthroughs. We talked about the negative effects of the prolonged stress, of not having a safe place, and the hypervigilance. And trisalts are helpful sometimes for these people. Limbic retraining can be helpful, but I would use the discs. I think people have done better in my experience when they go to the 3-day course versus the discs, because they paid a lot for the 3-day course, and they go, and if they buy the disc, they may or may not put them in, and there's a lot of discipline to it there. I don't think there's any real risks other than it won't work, but I've heard it's boring and it's labor intensive, but it can also be a great breakthrough for some people. I haven't had as high yield as some of the other docs with it, but I've had a few people have great breakthroughs. Some have had breakthroughs of these difficult patients with LDA, neurofeedback. Meditation and anything calming is very helpful. Continue to encourage resilience, explain this is going to happen and the body's ability to heal, and explain that there is no perfect place on this planet. So you're looking for settings that are good enough, not perfect, because you won't find perfect. This was there's a website that patients responded to. I'm not sure how many patients responded. It just gives an idea of things that they found to be helpful. So much of what we just talked about is listed on there. And these are the binders that they found most helpful, which is consistent with my experience as well. Activated charcoal being the most useful. Specific challenges, adrenal dysfunction, again, manage stress, support, really, if you're running constantly, and improve nutritional status. There's a specific adrenal glandular that's been very beneficial to a lot of people. Thyroid, big issue as well, but you got to get the adrenals controlled first so they can tolerate a thyroid. Many only need T3, and there was an article that addresses this that I'm going to review in a second. This is thyroid hormone regulation and how it can be these are the various places you can refer to that affects the T4 to T3 conversion. This was a study on NAC in helping low T3 syndrome, which is consistent with some of the approaches that we use. And this is glutathione helpful for one of the deiodinase activity. And I'm zooming a bit here, but you have it all in your slides, or at least your new slides that you're going to get. Again, glutathione, beneficial effects on T3, T4 ratios. Now, this one I'm going to spend just a moment longer on. This was August 2017, non-thyroidal illness in patients exposed to indoor air dampness. Small, very, very small study. But they had typical symptoms, chronic fatigue, cognitive symptoms. And again, they talk about the issues of conversion of T4 to T3, and not everybody does it well. That's the main issue, especially, some patients who've been exposed to moldy environments. So monitored the levels. Some of them also did receive adrenal support. They got hydrocortisone. That's not specific. That's not what I use, but DHEA. And they all got instructions. They all reported improvement with T3 therapy. And even though they were still exposed, the ones who were still exposed did have some residual symptoms. They were advised to adhere to a strict gluten-free diet. So that was kind of buried in the study, but that was part of it. But it showed that these patients can be treated successfully with T3 therapy. Again, you follow the labs. You look at the levels and the total to reverse T3 ratios. Stress, again, identified as a possible trigger for autoimmune thyroid disease. And effects of stress on the deiodinase activity. So, and that goes nicely into how you need to handle re-exposures. They will happen. They're going to happen. Guarantee they're going to happen. They're going to cause a temporary return of symptoms. All progress is not lost. Do not overreact to this. It's going to happen. They will become smaller. Recovery will become shorter. You have to also know sometimes your body is going to do what it does for no obvious reason related to your environment. And I think if people know that, maybe if they're receptive to it, they can ramp down the hypervigilance a little bit. Sometimes the problem is actually something in your environment, but it's really small. And I've had all of these. Rotten fruit, the apple or the orange went bad, or, part of shower curtain got trapped. And then you do get symptoms. You are reacting to it, but you don't need to run and you just fix the problem. You don't even need to change. You just fix the problem, and typically that will control the symptoms. Because if you run every time, I think the negative effects of that ultimately become worse on the health. Consider limbic retraining. Again, emphasize the resilience of the body. Project calm confidence that they can get through this. Treatment summary. Avoidance, important, especially at the beginning. Decrease total load. Glutathione, various forms. Sequestering agents. Nasal antimicrobials and biofilm disruptors. Nutritional support. In my case, by the way, it's all oral. I don't do IVs. There's nothing wrong with IVs if people need them, but again, you don't usually have to. Lifestyle changes. So with re-exposure, make your places you spend the most time as good as possible, and try not to sweat the unavoidable little exposures. Support, encouragement, resilience, and try and ramp down the hypervigilance. And thank you guys very much.
Thanks, Janette. If you'd be so kind as to make yourself available during the lunch. But right now we have a lunch with, not yet. Okay, we've got 5 minutes for questions. Okay. We're still, Tipu has a question. Yeah, you get.
Thank you.
There are two practical questions I want to ask you. Number one is, when you're doing the urine test for mycotoxicosis, do you need some provoking agent before? And give me a little protocol.
Yeah, think I had that yesterday on the diagnosis side, but about 4 days of oral liposomal glutathione.
Okay.
Also, don't take any sequestering agents at that time. If you feel terrible, do it the next morning. Otherwise, try and do the 4 days. I didn't have a specific dosage because some people are going to have stuff going on with a drop of glutathione or a quarter teaspoon. Other people, so I'm not going to tell everybody to take a certain dose, but because usually they're very new to it, they've never taken it before, so I don't know how sensitive they'll be. And other than that, I say don't overhydrate, and that is for the test that we've had the longest. You don't want to, for the new test, they correct for creatinine, so apparently the hydration in the first morning urine might not be a thing.
Okay. I don't know if, to you or ask the panel that from practical point of view, there are two issues that came up repeatedly in these complex patients. One was the heavy metals, and number two was the limes, you see. So the question in here is, when you're treating heavy metals, when do you know to start? Start the treatment, and when do you know that it's over with? And same way with Lyme disease, when you say you don't know what the hell is going on with the patient, and you do the Lyme test, it comes up positive. Now you're stuck. Is it really you really treat? You treat. When do you treat? When you stop? So I just
sure. I'll comment on. So heavy metals, much of what I'm doing can be beneficial for heavy metals, the glutathione, some of the other treatments. I'm not a heavy metal expert. I don't do chelation. However, there are patients who go and they do get benefit from it, so I'm going to defer to the experts on doing that. But the things I do can start to help with that. And as far as Lyme goes, I have commented, apparently Dr. Vincent agrees with me on this. The chronic Lyme thing seems to be more an issue of the immune response to it versus an infectious issue, and attempts to eradicate it from an infectious point of view are not appearing to be successful and can potentially be harmful. So I am not necessarily I don't address that specifically. I address inflammation, trying to get nutritional status optimized, get toxins out, and see what how they're doing at the end clinically, as opposed to labs, because I know, again, people know way more about that than I do. Partly because I haven't really found it necessary. My patients typically get better. And they may or may not have a Lyme diagnosis, and their husband sitting next to him, who is perfectly fine, may have way worse looking labs than they do. So I think it's a very confusing situation, like how much is it bothering an individual person, and what's the best way to make it not bother them? And I don't know if that's been answered. I think everybody's still working on it.
Wonderful summary talk, and you're going to need some hyperbaric oxygen, I think, now. But now that we're in the question and answer, could you mention your preferred adrenal support that you mentioned in passing?
I don't think I can, but I'll tell you after.
Okay.
Yeah.
Thanks, Janette. Excellent. I feel like Dr. Seuss for a second here. I want to speak for the trees, which in this case is the ultra-sensitive patients. As much as I have seen great value of glutathione, I want to put out a couple of cautionary tales here. First, really sensitive patients, and you did refer to it repeatedly, will really react badly to it. So not everybody can take glutathione, especially initially. As they get better, they often can. The other piece that I did want to mention is that glutathione is the end product of methylation. And by the cell danger response, the body intentionally shuts down methylation so that microbes can't utilize our machinery. They hijack our ability to methylate. And we intentionally stop that as a part of our defense mechanism. So everybody's going to have terrible methylation issues. It's just universal. Glutathione's the end product, of methylation. When you take it, it further shuts it down. So for some people who are not able to methylate, you really want to be careful about it, especially in the sensitive patients, because it runs the risk of really shutting down a process that's already compromised and not compromising it further. And so you can comment. And the second, to Tipu's question, since I treat a lot of Lyme as well, I agree with you here that Almost always, if I have a mold patient and someone with Lyme or Bartonella or something else, I treat the mold first. Number one, they can handle it better. Number two, as you're pointing out, and I completely agree, when you remove the inflammatory component, virtually you often don't see what looked like Lyme before. It goes away. What looked like Bartonella no longer exists because the mold is gone, and you've really improved that immune system, which can now contain all those other infectious components that you wondered might be a piece. So my bias is to always treat the mold first.
Thank you. Appreciate that.
We have 2 more questions, and then we need to break for a lunch. Let me go back right here.
I had a question. So a lot of these patients are extremely sensitive, and then some of them are not so sensitive. What are you telling them if they say, oh, I do see black in my shower, or oh, I do see black on my sink? Because, I mean, I understand how you can clean it with the solutions and such, but, I mean, do they rip their whole shower out and start over? Like, what do you exactly tell them?
Okay, so you start with, this is, it's one of life's many challenges and problems. You're going to approach it like you would anything else. This is not a trigger for, running to the woods and freaking out. But if you do have water damage or suspicion of water damage, the patient themselves might not want to be the one to check it out because they're too sensitive, but you have somebody look, you follow the water, you do look, my preference, and even personally if something happens, I get, the person I work with who does it safely to open up and look at what's there, and then you calmly remove it. You address whatever caused the moisture, whether it's poor ventilation in the bathroom, something leaked. You don't really know if you see mold in the shower. It's not optimal, and you don't want that, and you want that fixed. It could be a really significant problem. There's a pipe leaking behind, it's coming through, and you've got Stachybotrys, and it's kind of a bigger issue. It could be just some surface mold, which is still an issue. You still have a damp condition. But you just have them work with somebody who can identify, resolve the problem, and remove and replace the materials. And I specifically shook my head when you said use solutions, because I talked about that yesterday, how there's really nothing that's going to address it. Everything that's been looked at, you can't just topically clean it up. That is not the answer. You just need to figure out what caused it, fix it, stay calm, and get it fixed, of course. Yeah, get it identified and taken care of.
Just a thought and suggestion with regard to glutathione therapy. When you're using particularly high doses of glutathione, it does trigger the dumping of toxins from the cells because that's its other function besides being an antioxidant. And I think that ramping up sequestrants or binders when you're using them may help to prevent some of those effects. And also, if people are experiencing an effect, just have them take an extra dose of charcoal or clay and see if that doesn't help, because it often will.
Yep. Thank you.
Well, thanks, guys. I appreciate the time. A second-hand case and a first-hand case. I worked with Alan Lieberman at COEM, and he always talks about a case of the man who walked in with the usual crocky, crazy symptoms. And Alan was inspired and said, take off your shoe. And he had his staff scrape all the fungus off underneath the toenail and make an extract, which provoked all the symptoms, and then on the right dilution totally neutralized him. And he walked away cured. Now, my first hand, I was listed in Billy Crook's 1989 edition of the book as a yeast treater. And a patient from Chicago saw that I was a neuro-otologist and thought I was a neurologist. Oh. So she made an appointment, drove down to Louisville from Chicago because she had MS that wasn't MS, and her left arm never worked, and the neurologists were all in a big fight because they said she had it, but the scans didn't show it. So to give her something while she was down there, she had a lot of mold symptoms, so we did SET on her arm for the mold. And on the way home, she felt weird, and her symptoms completely cleared for the first time in years for the next 2 weeks. Mm-hmm. So I would say the neutralizing can be a great little treatment if you're set up to do it.
That's
Thank you.
Why we had you speak to us. I'm not set up to do it, but I appreciate that, yes, and I acknowledge that. So.
Hi, I work with Dr. Ray, and we do a lot of that neutralization. And when patients are really, really sick, we do actually neutralize them to glutathione to try and help them to get desensitized. But I wanted to mention to people that, if they can't do hyperbaric and they come to you and they're very cognitively impaired or they're very foggy and unable to cope, we do the von Arndine oxygen protocol, and that really helps. You just check the venous blood gas. If the venous blood gas is high, you know that the oxygen is not getting to the tissues. It's a nice way to get them, help their brain start to clear and their circulatory microinflammation.
Yeah, I appreciate that, and that reminds me, exercise with oxygen can be beneficial. For my next talk, I'll review the literature on that one. I missed that one, but it can be a beneficial thing for patients.
I think we're supposed to break for lunch, so if you'd make yourself available, Janette, for any further questions from the audience, let's eat. Thank you.